Hello, and thank you for joining today's presentation. Today, we will provide an analysis from quality management detailing recent ED wait time report discrepancies. Quality management has been tasked with determining an accurate measure for ED wait times for Harper Hospital in January. It is often helpful to summarize a collection of data to track trends and identify opportunities for improvement. Today, we will review the data and determine an accurate representation of wait times our patients are experiencing. Thank you to our physician partners for bringing this important matter to our attention. On the following slides, we will review the data and explain how we arrived at our conclusion. We are all concerned with increases in ED wait times, which may encourage patients to go elsewhere. There are websites available to patients with real-time ED wait times. Patients now have options and the technology to find them. It is our duty as healthcare professionals to evaluate why we are seeing increases in ED wait times, and the first step is to determine what those wait times truly are. As previously mentioned, patients have options and technology to find the options. For example, hospitalstats.org. Here we can see real live wait times for local area hospitals. It's critical that we determine the reasons for our extended wait times. On this slide, we see a brief visual description of the data we will be reviewing. This scatter plot shows the wait times for 30 patients in the month of January. Each patient selected for this graph arrived to the ED for treatment for a different diagnosis. Our discussion today will be beneficial in understanding the reason for the varied results and the importance of consistent and accurate measurement and reporting. Each of our evaluators provided their own review of the data. Quality management did their own analysis of the data and determined the results varied due to inconsistent methods of measures of center. The first method used to evaluate the data is the mean, which is commonly used to designate the average. This is computed by dividing the sum of all of our wait times by the total number of patient encounters we are reviewing. This calculation was reached by adding each value in the column and dividing by 30, the total number of patients. The mean wait time we came up with was 131.45 minutes for these 30 patients. The next method we used was median. This is considered the midpoint of data, or the point above and below which 50% of all values fall. It's worth noting that this is also the definition of the second quartile of data. This value is obtained by arranging the numerical observations in order and determining a middle value. The median wait time for these 30 patients is 131 minutes. Finally, mode. Mode is the measure of central tendency, defined as the value that occurs most frequently. This measure does not require any calculations. The mode for these 30 patients is 103. Each of our physician evaluators did an independent review of the data with the following findings. Evaluator A determined 130 minutes wait time. Evaluator B determined 126 minutes wait time. And Evaluator C calculated 180 minutes. Here we have all three measures side by side with the estimations provided by our evaluators. Notice the differences in results. This illustrates why it is important to use consistent measures when evaluating data. Reporting provided to agencies outside of the facility will need the most accurate data with which to make decisions. To summarize, the quality management team has been tasked with reviewing the truest measure of wait times being experienced by our ED patients. The team reviewed the results provided by our three evaluators to determine which measure is most accurate and should be used going forward. Our final results. The measure of central tendency that would be most beneficial for evaluation of this data is the mean. Notice the mean and the median are almost the same as that of Evaluator A. Going forward, it's the recommendation of quality management that the mean be used for reporting purposes. In reviewing our data today, we've seen that inconsistent measures of data can result in reporting inaccurate data. The intended purpose of the data can help determine which measure is the best fit. Are you truly looking for an average, the midpoint, or the most frequently observed? Each of our independent evaluators were right in their own way. However, each used a different method to review the data. Thank you for your collaboration with the quality management team. It has been our pleasure to serve you. Thank you.